Good morning to everyone, to Umberto, who joins us for the first time today, to our sign language interpreter, and above all, to everyone tuned in to this briefing. Today, 1,456 people are hospitalized in Cuba. 45 are under observation. There are 785 suspected cases and 626 confirmed active cases. Quite a high number, and the result of the large amount of positive cases we have seen over recent days. Yesterday, we processed over 6,000 samples, a number we have been trying to reach as cases have increased. Yesterday, therefore, 6,007 samples were processed in our various molecular biology laboratories. 2,069 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 815 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 539 in Havana's, 281 in Santiago de Cuba's, 471 in the Genetic Engineering and Biotechnology Center Lab, 460 in the Hermanos Almajedas Hospital Laboratory, 306 in the Manuel Fajardo Hospital, 624 in the Civil Defense Labs, 233 in the Molecular Immunology Center, 217 in the National Center for Genetics, 197 in the Naval Hospital, and 155 in the Fructuoso Rodriguez Hospital Laboratory. Of the 6,007 samples processed, 32 tested positive for SARS-CoV-2 and COVID-19. That's 32 people. This brings the total number of samples processed in the entire country since the pandemic began to 426,280, of which 4,298 people, or 1.01% of all cases, have tested positive for the virus. As I always mention, samples from all of the country's provinces and the Isle of Youth Special Municipality were tested. 140 from Artemisa, 4,588 from Havana, 136 from Mayabeque, 389 from Matanzas, 104 from Villa Clara, 205 from Ciego de Ávila, 150 from Santiago de Cuba, and so on and so forth from all of the country's territories. All of the 32 positive cases diagnosed yesterday are Cubans. One of the 32 cases is imported. The individual arrived in the country, was isolated, tested for the virus, and the COVID-19 diagnosis confirmed. Meanwhile, 31 are autochthonous cases. 24 or 75% are confirmed case contacts, hence the importance of first isolating and then screening all such cases. Despite all the door-to-door screening being done by health authorities and medical students, everyone who knows that they have had contact with someone who has tested positive for the virus, please report it so that you can be isolated and screened. I repeat, this work is being done by health professionals who ask all positive patients to name everyone they have had contact with over the last 15 days. That said, it is possible that some people are missed during this process. This means that 3,832 people, or 89.3% of all diagnosed cases in Cuba, had contact with someone who had previously tested positive for the virus. Of the 32 cases diagnosed yesterday, the source of infection linked to 7 is yet to be determined. This means that the source of infection in 52 cases reported over the last 15 days is still being investigated. Yesterday, one person to have tested positive for the virus contracted it abroad, for a total of 414 imported cases. Of the 32 diagnosed cases yesterday, 14 are male, for 50.1% of all cases, while 18 are female, representing 49.9% of all diagnosed cases on the island. As you can see, a similar rate between both sexes. 14 or 43.8% of the 32 cases yesterday were asymptomatic at the time of testing, representing 61.8% of all diagnosed cases over the last 15 days. A lack of symptoms is an important and complicated feature of the virus, which makes it very difficult to control. By age group, 5 positive cases diagnosed yesterday are under the age of 20, for a total of 453 children or pediatric cases under 18 years of age to have tested positive for the virus in Cuba. 388 or 85.06% of which have responded well to treatment and been discharged from hospital. Meanwhile, 11 people diagnosed with the virus yesterday are between 20 and 39 years of age. 11 cases are between 40 and 59, and 5 are over the age of 60. Of the 32 cases diagnosed yesterday, 20 belong to Havana, 4 to Ciego de Ávila, 3 each to Matanzas and Artemisa, and 2 to Mayabeque, one of which is imported, and the other autochthonous. The imported case from Mayabeque is from the municipality of Santa Cruz del Norte. Meanwhile, the autochthonous case from the province belongs to the municipality of Guines. Of the 3 cases from Matanzas, 2 belong to the municipality of Cárdenas and 1 to Matanzas. The 4 cases from Ciego de Ávila belong to the municipality of the same name. The 3 cases belonging to Artemisa are all from the municipality of Candelaria, and the 20 cases from Havana belong to the municipalities of Boyeros, with 3, Arroyo Naranjo, also with 3 cases, Regla, 3, Playa, 3, Plaza, 2, San Miguel, 2, and 1 each from La Lisa, Guanabacoa, Cerro, and 10 de Octubre. As you can see, the virus is present in 10 municipalities across the city. Yesterday's results therefore mean that Havana continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 23.18, higher than yesterday's figure. Artemisa follows with a rate of 14.37, only slightly lower than yesterday. Then Matanzas with 5.83, Pinar del Rio with 1.54, Ciego de Ávila with 6.86, Las Tunas with 0.93, Villa Clara's rate drops to 0.51, while Mayabeque's rises to 0.26, and Camagüey's rate remains the same at 0.13. This means that Cuba's rate rises to 5.90 per 100,000 inhabitants over the last 15 days. To summarize, Of the 4,298 people who have been diagnosed with the virus thus far in Cuba, 626, or 14.6%, are active hospitalized cases. 604 of these 626, or 96.5%, are clinically stable. Yesterday, no COVID-19 related deaths occurred in the country. This means that the COVID-19 death toll on the island remains at 100, with a mortality rate of 2.32%, lower than the global rate of 3.30% and regional rate, which stands at 3.46%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 83 people were discharged from hospital, a positive result as there were a higher number of discharges than positive cases reported yesterday. This means that, to date, 3,570 people, or 82% of all confirmed cases in Cuba, have recovered from the virus. Today, 4 patients continue to be in a critical state, and 18 reported as serious. Yesterday, 5 patients joined the group of those reported as serious, while 4 serious patients passed to closely monitored. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 276,620 people were diagnosed with the virus, for a total of 26,335,685 confirmed cases since the start of the pandemic. Yesterday, 5,674 people died of the virus, for a total of 869,209 COVID-19 fatalities and a mortality rate of 3.30%. The region of the Americas, which accounts for 52.72% of all cases worldwide, that's practically 53%, reported 122,037 new cases yesterday, for a total of 13,885,026 people to have been diagnosed with the virus. Of the 5,674 COVID-19 related fatalities reported yesterday, 3,263 occurred in the region, for a death toll in the Americas of 481,168 and a mortality rate of 3.46%. The United States continues to top the list of countries hardest hit by the pandemic worldwide, with over 6 million confirmed cases and more than 186,000 COVID-19 fatalities, of which 1,053 occurred yesterday. Brazil follows with over 4,124,614 cases and 834 deaths reported yesterday. Then India with 3,936,747 confirmed cases and 68,472 deaths, 1,096 of which occurred yesterday. This is the information we have on the behavior of the pandemic in Cuba and the world.